morning, everybody. My name is Betty, and my student ID number is S333935. And today, I will be presenting the topic concerning analysis, the strengths and limitation of sensitive communication in health and social care. But before I move further, let me explain a little bit what is communication itself. Communication itself, this is the passing informations, sharing emotional feelings between the two parties. Communication is one of the most important skills in health and social care every day. Health professionals like nurses, doctors, carers, support workers, uh, therapists, and many others use communication. This meaning a good communication help professionals to understand people's needs and also provides appropriate support and delivers effective care. Without effective communications, misunderstanding can occur, which may lead to a poor care. Also, mistakes or conflicts or reduce trust between the professionals and service user. Therefore, communication play a vital roles in maintaining high standard of care and promoting a positive outcomes in health and social setting. So the communication style that I have chosen today is assertive communications. Assertive communication means expressing thoughts, feelings, opinion, and concern clearly and respectfully. It allows individuals to communicate confidently while still respecting the rights and feelings of other people. Sensitive communication is particularly important in health and social care because professionals often need to share information like explaining the procedures, discussing the care plan, or raising any concerned case safely, like advocate for the needs of service user. These communication styles help professionals to speak confidently while maintaining professional and respect. So in today's presentation that I'm going to do, I will be explaining what a sensitive communication is. I will be discussing its key characteristics, analysis, its strengths and limitation. I will also explore how it is used in health and social care setting. I will also explain how it supports person-centered care and effective teamwork. In slide 2, I will explain what is a sensitive communication. So, what is a sensitive communication? A sensitive communication is a communication styles that allow people to express their opinion, feelings, their needs clearly, honestly, and respectfully way. It's also considered one of the most effective communication style because it helps people to communicate confidently while respecting the right of other feelings. Let's talk about clearly. Speaking clear. Clear communication means like sharing information in simple and understanding way. Expressing thought, feelings is one of the effective communication which encourage people to express their views. So, for example, like a support worker may say, "I understood the concern, but but I need to follow the care plan to ensure your safety." That is the example. So in slide 3, I'm going to talk about the characteristics of a sensitive communication. A sensitive communications has several importance characteristics that help health care professionals communicate effectively with a service user like family and colleagues. So these characteristics are as follows: is good eye contact. Good eye contact shows confidence, interest, and respect during the conversation, using also calm tone of voice. This is also an important part of a sensitive communication. Active listening. Active listening meaning like paying fully attention to the speaker and showing genuine interest in what they are saying. Another one is like respect for others. Respect is a key for success, I can say. For example, like a nurse explain medicine instructions clearly and ask the patient to repeat it, the information in their own needs, in their own words. This demonstration clear language like or active listening, confident and understanding what the nurse is saying. So in slide 4, I'm going to talk about the strengths of a sensitive communication. A sensitive communication has many strengths in health and social care. It helps the professional communicate effectively, provide high quality care, and build positive relationship with service user. Giving also build trust. Building trust, one of the main strengths of a sensitive communication. It is that build trust. Also, in another slide 5, I will talk about the limitation of a sensitive communication. Although a sensitive communication has many strengths, it also has limitation as well. Understanding this limitation help professionals use this communication style more effectively. Maybe misunderstood as being rude. So one limitation is that a sensitive communication can sometimes be misunderstood as being rude bossy confrontation, because a sensitive communication express their view clearly and confidently. So some people may mistake this confidence or for aggressive. For example, a nurse may firmly explain the importance of following treatment plan, but the patient may think the nurse is unfriendly. Also, cultural difference can affect interpretation as well. Can also create tension if poorly delivered. So in section 6, slide 6, I will explain more about application of a sensitive communication in health and social care. A sensitive communication is widely used in health and social care setting. It helps health care professionals communicate clearly, sharing the important information, building positive relationship between the personal care center and their safety. So in a nursing practice, nursing use effective communication when speaking with patients, families, doctors, and other health professionals. Also in residential care home or support workers, they use effective communication when discussing personal care or medication, daily activities, and many others. Also in community care, professionals support individuals in their own home. They also use assertive communication. In mental health as well, they use effective communication, assertive communication. Help professionals build trust between the professional and the service user. The same thing in the hospital, they use the same thing, effective communication, assertive communication. This in the hospital, the people who are in the hospital who use this most is doctors, nurses, pharmacists, therapists. So assertive communication is essential for sharing information accurately and encourage patient safety. For example, during patients handover, staff must clearly communicate important information about the treatment and the care needs as well. So in slide 7, I'm going to talk about supporting person-centered care. Person-centered care is an approach that focuses on the individual's reference, values, and choice for each service user. It places the person at the center of their care and encourages them to be individual in decisions that affect their health and well-being. It also encourages service user involvement. It's also improve in promote informed decision making as well. Respect dignity and preference as well. So I'm going in slide 8. Also, I will talk about the teamwork and collaboration. So teamwork and collaboration as a sensitive in health and social care setting, because many professionals working together to meet the need of service user. Therefore, the assertive communication play a vital roles in helping communicate clearly, respectfully, effectively, and many others. So in slide 9, I'm going to talk about the recommendation for improvement. Although assertive communication is an effective communication styles in health and social, should continue developing their communication skills throughout their career or their journey. Continue learning, helping professionals communicate more effectively, build positive relationships, and provide high quality care. Also, one of the way to improve assertive communication is thought communication training, maintaining healthcare professions, learning how to communicate clearly and respectfully in a different situation. It can help them manage difficulties, conversation, resolve conflicts, and improve professional relationship as well. Finally, by conclusion, in slide 10, I will say assertive communication is one of the most effective communication I've never seen, used in health and social care. It improves expressing thought, feelings, opinion, concern clearly, confidently, and respectfully, while also respecting the right and other feelings. Throughout this presentation, I have explained a lot. I have explained how assertive communication supports effective communication between the health professional and service user, families, and colleagues. It helps ensure that important information is shared accurately and understood correctly, leading to a better care outcome. Assertive communication has many strengths as well. I said it before. It helps build trust, improve teamwork, reduce misunderstandings, support patient safety, encourage effective and promote confidence. These benefits are important because they contribute to the delivering safe, high quality and person-centered care. I also discuss some limitation of sensitive communication. For example, I talk about that it may sometimes be misunderstood by being rude. Cultural difference can also affect interpretation. I also talk about some professional may find it difficult to communicate sensitively due to lack of confidence or experience. However, these challenges can be managed through effective training and practice every day. Thank you so much for listening. I will end here. Good luck. See you next time. Bye bye.